Hey, Jimmy, somebody had a question. Like they've had this question several times.
Let me hear it.
Okay, because you've really got to respond to it. So the whole idea of better healthcare, universal healthcare, how can you trust the government to deliver Medicare for all?
God damn this. Are you kidding me?
No.
This is that question?
This is this question. And
okay, here's the question. Here's the answer. How do you trust the government to get the water to your house every day? How do you trust the government to get the sewage out of your toilet every day? How do you trust the government? I don't know. If you ask people, if they do surveys, the most popular health insurance program in the country is Medicare. So I want one that's better. So I'm not saying it's going to be perfect, but it certainly is going to be better than a for-profit system that has us paying double what the rest of the world pays for worse outcomes. Why is it the rest of the world's governments can somehow deliver health care in a way that's half as expensive and gives you better results? I want that. And that doesn't, again, the government isn't giving you health care. They're paying for it. The government's not going to run the hospital I go to. The government's not going to run my doctor. What the government is going to do is cut a check to the doctor that I go see. That's what the government's going to do. The government isn't going to hire a doctor and send me to a government doctor. I'm going to my regular doctor, except that now it doesn't cost twice as much because we're cutting out the middleman and we're regulating drug prices. That's the difference. Okay. Hey, how could you drive on a road? It's been built by the government. How could you go into a post office? It's built by the government. How could you go into a library? It's built by the government. How could you go into a college? It's built by the government. Again, that doesn't mean it's perfect. It means it's better than a for-profit idea of how to deliver education or health care. Does that answer the question, you think?
Did you ever go into debt because of medical bills?
Yes. Guess what else you don't do when you have Medicare for all? You don't have to worry about getting sick and going broke. Because you know how many medical bankruptcies they had in Canada last year? 0. You know how many the year before? 0. You know how many people died because they couldn't get health care? Probably 0. So there you go. In America, people are on the streets. They're bankrupt. I got bankrupted because of health care, and I had insurance. Most people who go bankrupt from medical bill have insurance. So that's the jokey there. So that's why. So that question, people always say that. They say, if you don't trust the government, why do you want them to run your health care? They're not going to run my health care. They don't run. They pay the doctors. My father, when he goes to a doctor, he doesn't go to a government. He's not seeing a G-man. He's going to his regular doctor. The same doctor he went to see when he was working, and now he's retired. Same doctor, he doesn't have to pay for it. That's the difference. And there isn't a middleman charging 30% markup. Okay, so
all right, that's great.
But if you want to trust Big Pharma, you think Big Pharma and health and big health insurance companies are giving you a better deal than you would get from a public option? Do you know what the public option even is? Do you think you're getting a better deal from Aetna and Blue Cross and Big Pharma than you would be getting from a public option or Medicare for all? Do you really think that? Well, you're uninformed in the extreme. Everybody come see our live stand-up shows. We're coming to Raleigh, North Carolina at the end of January and Philadelphia in February. See you there.